Hey everybody, welcome to my YouTube channel. My name's Ashley Agan. I'm a board certified otolaryngologist, which just means ear, nose, and throat doctor. Wanted to talk to you today a little bit about ear tubes. What are ear tubes? Who needs them? What to expect as far as pre and post-op? So indications for ear tubes would be recurrent ear infection. So lots of little kids have recurrent ear infections where they're on antibiotics over and over again. The guidelines suggest that if there's a certain amount in a certain time period, for example, more than 3 in 6 months or more than 4 in a year, then we might start thinking about putting in ear tubes. The other indication would be if there's fluid in the middle ear, so fluid that's stuck behind the eardrum that can cause hearing loss, which we particularly worry about in little kids because it's a peak time for language development. And if they have fluid stuck behind their eardrum, then that can cause it to sound like they're basically like they're hearing underwater. And so when we start talking about ear tubes, the procedure itself is very short. It involves making a small hole in the eardrum and then placing the tube in that hole to prevent that from healing up. The tubes themselves are very small, about 1 to 2 millimeters, and the tubes will stay there for about a year on average. The tube will then eventually fall out. Typically the eardrum heals up, and hopefully by that time patients have stopped having recurrent ear infections. The eustachian tube has matured and is working a little bit better, and most kids do not need a second set of tubes or any sort of additional treatment after the tubes have fallen out. Like I said, it's a pretty quick procedure. We can do it in the operating room or the office. In the operating room, it's a short general anesthesia with mask ventilation, so there's no intubating tube placed in the airway. It's just anesthetic gas delivered via a mask. In the office, we swaddle the young kiddos and place numbing medicine right on the eardrum, which allows us to quickly place the tubes. Afterwards, the post-op care is very minor. Usually, if kids are having sensitivity in the ears, they can take Tylenol or Motrin. Sometimes you might see some drainage from the ears because that fluid that was stuck behind the eardrum is now able to come out. And sometimes we'll treat with eardrops. Sometimes we don't have any sort of post-op care as far as doing anything to the ears. I personally like for families to refrain from submerging the ears for about a week after surgery. And then after that, as long as they're going to be swimming in clean water, so for example, in chlorinated water like in a pool, or if they're in the shower or the bathtub, you don't have to prevent water from getting in the ears. However, if they're going to be at the lake, for example, or in the ocean, any sort of water that's untreated, I would prefer earplugs in those situations. Other common questions for post-op considerations: when can kids fly? So flying is okay immediately after the tubes are placed. The kids will have no trouble flying after tubes. And generally, they can return to normal activity pretty immediately. If they've had general anesthesia, we have to obviously wait for that anesthesia to wear off, for them to wake up a little bit more. If we've done it in the office and there's no general anesthesia, then they're going to literally be able to return to whatever activity they were doing. So they're okay to go to school, etc. If you have other questions about ear tubes, go ahead and put those in the comments below. And please like and subscribe. We'll see you next time.